And so apparently Brad had to step away. But, as is the case with sports, and, you got to be the next man up. So I'm your sixth man, Jeff Beglin here. And got the capable Eric Pouncey Jr. also on hand to help with all the technology issues. And, this recording is being, filed away, so everybody will get a copy of this. And why don't we get things started? Tony, can you hear me? Tony?
Yes, I can. I actually muted myself. I couldn't.
Oh, that's okay.
Couldn't get unmuted fast enough.
Okay, and I'll just throw my camera on here just so you know what I look like. So I'm so glad you could join us, Tony. We're thrilled to have you on board and talk about CareSource and the ACA. So let's just get going here. So you know the drill. You got any issues? You got a question? Got anything going on? Throw your comments in the question box. Whether it be an issue with the sound, the technology, or more importantly, you got a question you want answered considering the content. We'll monitor these throughout the presentation. We'll jump in if there's something we can answer right away. By all means, we will have everything answered by the end of the presentation. So that's our housekeeping. And then here is the three musketeers of the insurance industry here in Ohio. Mr. Petrella, I think, will be joining us in a little bit. He's in Northern Ohio. He's our business development director. And there's my information, including my phone number, email address. And then Eric, make a quick shout. Let everybody know.
Yeah, thanks everybody for joining this afternoon.
Fantastic. Okay. So, and then Eric, you want to roll through Sherpa? That's kind of your bailiwick.
Yep. So Health Sherpa is our enrollment platform that we use, that we offer to all of our brokers. It's pretty quick getting everything done. If you want to send quotes out to your clients, it's no cost to you. We set up everything for you. We have a link on our resource center. If you fill that out, that'll get sent over to us, and then we'll get you rolling on that. But yeah, you can enroll your client straight through Health Sherpa, and cuts down on the time with you messing with healthcare.gov. So.
Okay, great. And then if you didn't already know, all of Cornerstone's webinars are recorded, and they're in the resource center and are under the webinar series. This is a treasure trove of information, and the CareSource webinar, including the slides, in the YouTube format, will be housed out there for you to review. And if you have any issues, just contact me or Eric, and we can get you rolling on the Cornerstone Resource Center. And Tony Cato, Tony, you are in the Cleveland area, right?
Yeah, I live in the Cleveland area, but I handle all of our states.
You handle all of your states. Okay, yes. Fantastic. I am going to transfer the presentation to you.
Okay.
And you let me know when that comes over.
Okay. Show my screen.
Okay. I'm going to kill.
Like I said, this is the first time I've used it.
Okay.
Go to webinar.
You're doing great. You're doing great. Fantastic.
Do you see?
Yeah. And if you would, you're in presentation mode. We're off and running. Terrific. Thank you so much.
Oh, good. Thank you. I love it when technology,
I'm on, by the way,
is I'm challenged. I'm sorry. Was that a quick question?
No, it's just Brad finally got my VPN to work.
As we're talking about
welcome,
technology
everyone.
Yeah,
I love it.
We're off and running. Glad to have you, Brad. So Tony is just starting on his slides. So take it away, Tony.
All right, great. Thank you. Welcome, everybody. I am Tony Cato. I am the National Broker Account Manager for CareSource. I always find it important to state that prior to coming to CareSource about 10 years ago, I was a broker myself, had my own agency. I was in the group market since 1988. I find that important so that you know that I understand, right? I've been in your shoes. I know the hurdles you have, and I know the tools that you need. And so I've been trying very hard to make sure that CareSource can remove as many of those hurdles and give you all the tools that we possibly can. We've got more coming. But first, for those of you who may have, heard the name CareSource, but may not know who we are a nonprofit. We're stationed home office out of Dayton, Ohio. We are currently in the states of Georgia, Kentucky, Ohio, Indiana, Arkansas, West Virginia, and North Carolina, primarily in the Medicaid, the marketplace, and we do have a D-SNP plan in the state of Ohio. I think the most important aspect of CareSource is that we are a little bit different than most of the other carriers that are out there, and it's our culture, right? Most of the carriers, state that they're looking to improve people's lives and make a difference, and I'm sure they are, right? I'm not here to disparage anybody, but at CareSource we take it up a notch. And I think the best example of that is our life services program. This is a program that is available in the states of Indiana, Ohio, and Georgia. And what life services is for those members who have one of our products, right, whether it's Medicaid, Marketplace, or the D-SNP, they are handed a life coach. Now, obviously, they have to enroll in this. It's free. It's part of the plan. But they have to state that they want to be a part of this. They are given a life coach, and this life coach, their purpose is to provide job training, job placement, if they need help with utilities or rent, getting an outfit for an interview. Maybe they need the resume written, right? I mean, because one of the things that we realize in CareSource is, obviously the diet people eat, the non-exercise they get, whether they smoke or not, are factors in their health. But also there are the social determinants of health that weigh just as much on a person's health as their diet, for instance. If somebody is in a job that just isn't advancing them in life, they're always behind. They don't have time to get the education they need to improve their lives. This is where Life Services steps in. It's a 2-year program, and the life coach is with this person every step of the way. So, whatever their needs are, large or small, Life Services is there to take care of them. And again, it's part of the plan, right? This isn't an extra premium. It's built into every one of our plans. And I think it's also important to note that it's not just for our members, but anybody who resides in the house. So if you have, for instance, you've got the father on a CareSource Marketplace plan, and the wife needs assistance, and maybe she's with Ambetter, maybe she has, benefits through her job. It's available to her. It's available to the kids. If grandma's living in the house, it's available to her. So it's just not for the members. It's for all members of the household. Any questions on that before I move forward?
Nothing up. I think we're
Okay.
good. Yep.
All right. Very, very good. The other nice thing about CareSource is roughly about 90% of all the income that comes in is put back into the members. That gives us a great administration cost. But that's how important the members are to us, that the revenue that comes in doesn't get put into a bank account and pay large salaries. It goes right back into the members. Every carrier has an app. We have an app. Our app is good. Their apps are good. I put this slide up because we from the service end, we get a lot of requests for duplicate cards, or to find out what their benefits are, or who's in the network. And so we always like to put this up just to remind everybody that when you enroll somebody, irregardless of the carrier, right, put the app on their phone. It cuts back on a lot of your service work, cuts back on a lot of our service work, and it gives a better experience for the member. Okay, now we're going to discuss our 2024 plans. As many of you may be aware or maybe not be aware, CMS has come out with a rule limiting the number of plans that carriers can offer. I think we're getting closer and closer to the days where we're going to have Plan A, Plan B, Plan C, like they do in Medicare. But right now they're limiting the number, and then they're also putting out federal standard plans. And so if you're familiar with our current offerings, you're going to see some of them are disappearing. Not as much as some of our carriers. We never had a whole lot of plans anyway. The one drawback that we have to this rule, and we're trying to get it changed, is because of the fact that CareSource offers our enhanced benefits, right? This is the dental, vision, and the fitness benefit. They consider that an additional plan. So if you buy a bronze plan, that's one plan. A bronze plan plus enhanced is the second plan. So we're kind of limited down to 2 plans, where carriers that don't offer that could have 4. So you're going to see some plans drop off, and that was just out of necessity by law. And we got rid of the ones that had low participation anyway. So, but just be aware. Okay. For our footprint across all of our states, here's the state of Ohio. As you can see, we are statewide except for Knox County. Matter of fact, I think the only carrier that has Knox County is Anthem, although I have heard rumors that maybe Aetna is going to be in Knox County this year. Last year, we didn't have, or I guess currently this year, we don't have Athens County, but we are expanding to Athens for 2024. So until we can get that one hospital in Knox County to sign a contract, this may be about as statewide as we're going to get. In Georgia, we are basically in the Atlanta, Savannah, and Brunswick areas. We have no expansion in Georgia this year, although we are looking at significant expansion for 2025, primarily in the Macon, Augusta, and back in the Gainesville area. So more to come for 2025, but for 2024, Georgia stays the same, as does Kentucky. Again, you're basically, if you're looking at that swatch, there's 2 different hospital systems. They're relatively small, but they're large enough that until we can get a contract with them, we're not going to fill out that western side of the state. Indiana and both West Virginia are going to be statewide. They have been. They'll continue to be statewide. And then in North Carolina, we are in rating area 1, which is to the far west. We did have hopes of expanding to areas 2 through 7 this year, but we got notification about 2 weeks ago from CMS that we needed a couple more providers to have a credible network. We didn't have time to get that done because they didn't give us an extension. But so I would look for next year to have significant expansion in North Carolina. Okay, for our bronze plans, the low premium bronze is the one you're going to see that's going to disappear from most of the states. That's the plan with, it's got the high deductible, right? No copays except for generic. It's going to remain in Indiana because of the fact that we had lots of membership in Indiana in this plan. So it's staying. We have our Bronze First plan, which is our most popular plan by far. Matter of fact, this is now the federal standard bronze plan. We were the first ones out with it for the longest time. We were the only carrier, at least in our states, that had a bronze plan with first dollar copays. Now it's the federal standard plan. So I'm not sure if they copied us or it just worked out that way, but the Bronze First will be available in all markets. And then we do have an HSA plan that will only be available in, Indiana and Georgia. Any questions on the bronze plans?
Hey, Tony.
Nothing came
Brad.
over. Yeah, go ahead.
Are the RX, is that
Yes,
before deductible or inclusive of deductible?
No. Yeah, I'm sorry. Yes, it is before deductible. There is no prescription deductible. You don't have to meet the deductible before the copays kick in. Yeah, it's first dollar.
That's a good point.
If you have a question, great. Then by all means, if you have any comments or questions, throw in a question box, and Tony will be happy to answer those. So Jill asks, I wish you'd bring the HSA back to Ohio.
Yeah,
All of our
every
HSA
year.
clients to Ambetter.
Yeah, we've at least on the sales side, we've been pushing to bring the HSA back to Ohio. The brokers have been clamoring for us to bring it back to Ohio. I'm not holding my breath, but Ohio has heard it, and there's a really good possibility we may see it for 2025. There's a market for it. The problem we had in Ohio is it had very low membership. Now we kicked it out before the limitation, but I would be very happy if for 2025 on the bronze side, we had the bronze first in the HSA in Ohio.
Thanks.
Very possible. Very possible. Okay. How come we're not advancing? Oh, you know what? Nice. Screen froze.
Screen pros. It's that kind of day. Internet.
Yeah. Yeah. Is it advancing on your end?
No, unfortunately not.
No. It's
There we go.
It's
there we
the
go.
technology Goonies.
We got it.
Okay. All right. As I'm sure most of you know, that except for a couple rating areas here and there, we've never been a silver focused plan. We are changing that, right? Now we have a 3-year plan to get our silver plan to a competitive footprint. I am happy to tell you that where in some rating areas right now, our silver plan is about $120 more than, let's say, Ambetter. For 2024, that difference is going down to about $30. So we're getting closer. I don't think, and again, except for a few rating areas, we're there. I mean, obviously, there's provider issues that come into play on the silver side. But we're still not going to be the most competitive silver plan out there. However, what we are excited about is our new diabetic silver plan. This is going to be effective for 1/1/24 effective dates. As you can see, the deductibles are low. The copays are in line. The drug card is low. But most importantly, for a diabetic, this plan offers $0 insulin, $0 testing, test strips, monitors, and it's also going to have, like the Jardiance and the Ozempic will be available for a copay. So we're very excited about this. The pricing on this plan is very competitive. When we look at the amount of money that a diabetic could save, and basically we're talking about an insulin diabetic, because although the prescriptions for like metformin and whatnot, those are also $0. But when you're looking at an insulin diabetic, they're looking to save between $100 and say $130 a month. But this premium, now I've only seen Georgia and Indiana, but in those two states, the premium for this diabetic plan is about $50 more than, say, again, Ambetter's standard silver plan. We've gotten a lot of excitement about this plan. The brokers are enthused by it. We have more training that's going to be coming out on it, a brochure that's going to list all the medications that are in the formulary. But when you're looking at the insulins, we got 4 of the 5 top national brands that are covered in the formulary at $0 cost. So this is an exciting plan for us. And we think we're going to do very well with this silver plan. We'll get to the other ones in the next year or two, but this is a plan that has drawn a lot of attention through the road shows and some of the other trainings we've done with other agencies. So look more for that to be coming out on this. You can start selling this one 11/1 for the 1/1 effective dates. Any questions on that?
Tony, it's Brad.
Yes.
It's Brad. Do you know the 4? I'm guessing Humulin, Humulog, Lantus. What's the 4th? Or maybe I'm completely off base. Do you know those insulins?
I'm on a call tomorrow that we're going to get a list of everything. All the
Oh,
four,
okay. Great.
the
Share
four
it. Give it to
insulins.
us.
Yeah, because right now what I have is 4 of the 5, right? And I've already told them
Okay.
that's not good enough for a broker. So we're meeting with the formulary people tomorrow, and we're going to get all the prescription drugs, all the insulins, the cost shares for the Ozempics and Jardians and whatnot, which test strips are covered. So we'll all have all that tomorrow afternoon, and of course we'll get that out to you.
I do want to jump in here with a question
Great.
pertaining
Sure.
to this. The question is, can it only be sold to diabetics, the silver plan?
No, this plan is available to anyone, right?
Okay.
You know, so if you have somebody that maybe wants to become a diabetic, sure, put them on it. You know, we still have the issue of it's, you know, it's $50 more than a standard and better silver. But yes, I mean, you do not have to be a diabetic to be on that plan.
Right.
And of course, this plan will also be available at the CSR level.
Understood. Thank you.
Great.
All right, every time I move that chat box, it won't let me click. There we go.
Tony, are you
We
working
also,
with 2 screens or no?
no, I just have the one.
If you're working with 2 screens, okay. Okay.
Yeah, so I just got to keep clicking different areas. Like
Okay.
everybody, we're mandated to have a goal plan. We have our goal plans. Obviously, you know, we don't get a whole lot of play on them. I think it's like 1% of the market chooses the goal plans. They are there, very competitive. Matter of fact, if you do any selling in Georgia, there's a couple rating areas where our gold plan is cheaper than our silver. But it's also, there is the diabetes gold as well. So we will have that diabetic plan on the gold level. I'm sure there's no questions on the gold because very few of us actually sell it. Okay, this is the one slide that talks a little bit more about the diabetic plan. This is fine, but we want to be able to say what are the preferred diabetics, what glucometers are covered. I'm going to say that like, so I want to get you guys the actual names of the things that are covered versus just a very generic. So, you know, the cost shares here are accurate, but I want to get you the actual formulary list. Okay, our telemedicine benefit. This is built into every one of our plans. It's a zero cost telemedicine. So irregardless of the time of day or where you are, because you can use our telemedicine nationally, it's available, right? And it's $0. There's no copay for it whatsoever. The teledoc, they can prescribe medications, nothing controlled. But if you happen to be out of town and they prescribe you a Z-Pack for your cold, you can have it shipped to, you know, any one of the in-network pharmacies, even that it's out of state, right? Our CVS pharmacies nationally. So you have healthcare no matter where you go. The other nice thing about this is it does also include behavioral health, right? So there is a counseling aspect available to this. It is also at $0. Right, so instead of having to go and sit on somebody else's couch, you can sit on your own and have a counselor session. With the telemedicine for the doctors, they try very hard to give you a doctor that is in your geographical area, right? I use telemedicine almost exclusively anymore, and probably the 10 times I've used it since COVID started, I've ended up with the same doctor 9 times. So that's nice. But with the behavioral health aspect, they will keep you with the same counselor from one session to the next. Any questions on that? Okay. All right, this is, here the slide says optional dental, vision, and fitness benefits. This is what you will see on Health Sherpa, healthcare.gov, the enhanced benefits, right? So if you see bronze first, and then bronze first with enhanced benefits. The enhanced benefits are the dental, vision, and the fitness. For the dental, we use DentaQuest. We have a $1,000 annual allowance, zero cost share for diagnostic preventative. In all honesty, we're having some issues with DentaQuest. We are actively working with them to correct those issues. We've made improvements in many rating areas throughout the country, but we still got a little ways to go with them. So I just wanted to make sure that if somebody is wanting the bronze plan and then they want dental, that you're just upfront with them to say, you know, there are some issues with this dental, right? And the biggest issue is that although we show plenty of dentists in the network, when somebody calls around to get an appointment, all the dentists in that network say they don't take it. So obviously a problem. We're definitely going to improve upon that. Adult vision benefits, this is through IMED. This is a fantastic program. The benefits are very good. The service has been outstanding. I get no complaints on our IMED whatsoever. Everybody loves this benefit, and it does even offer a 15% discount on LASIK vision correction for anybody who doesn't want to wear the glasses. That's available as well. And then the last part of our enhanced benefit plan is the fitness benefit. Probably the biggest feedback I get from most of the brokers is when they sell the enhanced benefit package, they sell it because of this benefit right here. This is not a discount program. This is free membership, right? And we're talking places like LA Fitness, Snap Fitness, Anytime Fitness, Planet Fitness, right? I always like to tell the story that I've been donating to Planet Fitness for 2 years now. I give them $26 a month, and I couldn't even tell you where they're located. I've tried to cancel it, and it just they tell me I got to stop up to cancel. And I said, well, if I could stop up, I wouldn't have to cancel it. You know, so for the $10, you get a free membership to Planet Fitness, or you know, the next day you can go to LA Fitness if you want to. This also is national, right? So if you happen to be in California and you want to use a gym, you just go to activeandfit.com, you plug in the zip code you're in, and it's going to pop up all the participating gyms. There's about 7,000 of them worldwide. You can also get a home fitness kit, you know, those little barbells or the rubber bands or whatnot. There's some videos online that you can follow along with. You get a healthy living coach. This has just been a fantastic benefit for us. The membership in this is growing every year, and the participation has been outstanding on it. So if you're looking for somebody or somebody's looking for a fitness benefit, you can't go wrong with Active and Fit. Okay, that's the basic presentation on our 2024 plans. We also like to show you a little bit of the heat map presentation. We call it the heat map presentation, although there's really no heat map to it whatsoever. I just didn't know what to call it 4 years ago when I started it, so I called it a heat map. But this is a training we put on every year. It is during this year, it's going to be during the week of October 22nd. There will be 2 trainings a day. Each one is a different state. And what we do during these heat map presentations is we look at each rating area, which competitors are in that rating area. We look at everyone's networks. We look at everyone's rates and their benefits, right? And so, you know, we're going to go into, let's say, Atlanta rating area 3. We're going to show you all the competitors that are there, what their benefits look like, what the premiums are. And I think that the thing that we are most proud about this training is it's what we call a data dump, right? It's not a sales tool. It's not a commercial. If Ambetter happens to be the best carrier in a certain rating area, you're going to see that, right? We don't spin this in any way, shape, or form. So you're going to see where we're the best. You're going to see where Ambetter's the best, or maybe Anthem's the best. But how it basically looks, besides looking at the service map, so here's rating area 3. Here's all the counties that are in rating area 3 and all of the participating providers, right? And then you're going to see that there's, and I always find this interesting, in rating area 3, Atlanta, there are currently 430,000 marketplace members, right? This isn't population. This is population on the marketplace. And when you look at just this one rating area in Georgia, it is larger than the states of Indiana, Ohio, Kentucky, and West Virginia combined. It's that large of a rating area, right? So we like to point that out so everybody knows. It'd be great if, CareSource was the best in rating area 7, but there's only 5,000 people there. Maybe you don't want to spend marketing dollars going after that.
Just a quick question.
Yes,
what
sir.
day is this presentation again?
There's going to be an official invitation that's going to come out probably within the next week, and it'll break down when each state is. I know
each state will have a different.
Ohio and Georgia are on that Thursday, and they are always the last two that we do, due to the fact that we can't put these together until we get the numbers from CMS. And Ohio and Georgia were always the last ones to come across, so we always move them last. Although this year I already have Georgia, so okay.
Yeah, I will send you that invitation because I already have it. I got it.
Okay.
I think today's only Tuesday. Yesterday.
Yep.
Fantastic. Okay, we do have a couple questions. Can I jump in here?
Yeah, go right ahead.
And then, well, obvious question: what kind of increase can we expect from CareSource in Ohio?
Minimal. We are going to. Yeah. No, I haven't. I think it's under. I think it's like 1 point something. Now, when you're looking at those increases,
yeah,
it's an average, right? So just because we could be at 1.7, or even if we were 8 point, right? That's, some areas could be negative, some areas could be 25%. When we get the rates, I'll actually see in each rating area what the increase is. Okay. Right? But I do know that we're going to look very competitive in the northern part of the state. We should be a lot more competitive in Columbus. It kind of depends on what our competition does, but we didn't take much of an increase at all in Columbus. And our increase down in the southern part, the Cincinnati-Dayton area, was also relatively small. So again, it depends on what the competition does, where we're going to end up. But we'll have, once we do the Ohio heat map, it will be available to see.
Okay, I got a quick question here. Where can we find the benefit for the enhanced coverages? They never show up on the summary of benefits.
There is, we have a brochure that we have put together that is on PrintSource, right? So if you have access to PrintSource, you can go in and download that, and it details it quite nicely, actually. That was a piece we put together last year. So you can see it there.
Great, thank you.
And the one for 2024, I believe, is already out.
Fantastic. Okay, we're caught up.
Okay. All right, so after basically looking at the footprint of the rating area, then we show you the networks. So we list every hospital that is in that rating area, and then of course the check marks, right? And so a lot of brokers like to use this. They pin it up on their wall. So if they're talking to somebody and they say, "Ah, you know what? I need to have Cobb Hospital in my network," then it's a real quick reference. You can go out and you can say, "Okay, well, that's a bad one because we're the only ones." But if you go to, say Emerly, Wesley Woods Hospital, right? You can say, "Okay, well, Aetna has an Ambetter and Anthem have them in the network." So it's just kind of a tool so that when you're on the enrollment portal, you don't have to keep clicking it to look at the networks. Of course, with Health Sherpa, you can put that all in the beginning and it'll show you. But this gives you a really good, one-page look at who's got the strength of networks, right? You can see right off the bat, CareSource, Ambetter, and Anthem have got strong networks. Aetna's not bad at all, but Alliant, Kaiser, Oscar, and UHC are relatively small. We always like to point out that we do this manually, right? And so we go onto each carrier's website and we pull up their provider tool. And so it's as accurate as their provider tool is. And this is a good example because this is from last year. And you can see Cigna has no hospitals. Well, that's because when we did this mid-October last year, Cigna was new to Georgia, and they weren't showing any hospitals in their network yet. That's why they're showing blank. I knew which hospitals Cigna was going to have, but you know, if they're not showing it, I can't show it. So you know, we do get a lot of feedback of, well, you know, this hospital has dropped Ambetter, or Ambetter just picked up this hospital, which is great. But if they're not showing it on their tool, then I can't show it.
So
then, of course,
Tony, it's great to hear about Atlanta, but do you have any slides on Ohio, or any hospital additions or declinations yet?
Yes, I'm just giving you an example of what the heat map looks like.
Oh, I thought you were holding out on us.
No. We are doing Ohio. Right. I think it's the
26th.
26th. I think it's either a 10 or 2, 10 or 1. But I don't have the information from CMS yet. So
got it.
I could show you last year's Ohio, but you know, I have updated information here. So I updated this one. Yeah, but now you can see the premium for each plan. Now we don't do all plans. We just do low premium bronze, low premium first dollar, low premium silver, and then the diabetic plans. We highlight who's got the lowest premium, right? Again, this is a data dump. We're not going to tell you that, you know, Aetna's plan for $343, basically $6 more, is the better option. You're a broker. You're capable, right? You're making, you know, my opinion is not always going to be your opinion, so we don't try to give it. I do discount on here Kaiser and Oscar because their networks are so small, but we still show them because there's a market for them, right? There are people out there that want Kaiser, there are people out there that want Oscar, but when you look at the enrollments, their enrollments in these areas are very small, so we don't say this is your best option. And that's basically our heat map presentation. That, again, these will be out October 22nd, the week of October 22nd. And we will make them available after the presentations, only because of the fact that a lot of times Ohio, I'm finishing it up the night before, how late I get the information from CMS. So,
hey, everybody, I'm going to put that link. I'm going to put that link in in case you didn't see it. I know it's a busy time of year. I'll put it in the question chat bot here, and you could just click it on and add it for yourself.
Excellent.
Cool. I'm full service like that, Tony. Don't you know that?
And that's basically our presentation.
Okay, I just want to jump in here. There's an additional question, Tony, and I have a couple questions myself, but just a final question from one of the brokers. Is CareSource paying commissions on these plans to agents? And she's referring to the health plans. Maybe there was a rumor that they weren't, or?
Yeah. You know, this is one of the things I find it important to note that, you know, because I was a broker for so long, there's nothing you're ever going to sell that you don't get paid on. Yeah. And we've tried every year to increase commissions. There won't be an increase in the commissions in Ohio this year. And that has everything to do with the fact that we've got the highest commissions in Ohio right now. I couldn't get them to budge on it this year. We are increasing commissions in West Virginia, in Georgia. Indiana staying the same at 25.
What is the amount in Ohio?
21.
21 PM. Is there a cap on that, or?
No, it's per member per month. There's no cap. Okay. So if you happen to find somebody with 16 kids, you can retire.
Yeah. Jeff, I think maybe the answer to Christine's question is, I think CareSource is one of the carriers that commission comes to Cornerstone first, and we distribute it to the agents. Or do I have that mixed up with a different carrier? Is that what you mean, Chris? Are you getting commissions, Christine?
I mean, the way I read her comment was, I was told in the past that CareSource do not pay commission on health products. They absolutely do. They pay.
On what products?
On health products. I think
Oh yeah.
So
there was
we
a
would
time
even
a while ago, maybe 10 years ago, that agents weren't.
Yeah. We started the broker program 4 years ago. And so prior to that, we did not pay commissions.
Yeah.
But since 2018, we have.
Yeah. Okay. So
Good.
let's and then you know, we were just I temporarily forgot my question, but yeah, are you able to give us just a tease of the networks in Ohio, the three main cities, Cincinnati, Columbus, Cleveland?
I'm most familiar, obviously, because I'm up here in Cleveland, most familiar with that. We do have university hospitals in the Cleveland area.
Mm-hmm.
We have OSU in Columbus.
Oh, really?
And what is it in Cincinnati, the big hospital systems on
Tony,
there?
I might be able to help you.
Well,
Then you
Children's
can.
Hospital is the crown jewel. I mean, that's the must-have that drives so much
Which
business
one
your
is
way
it?
down here. It's the pediatric hospital called Children's Hospital.
Oh yeah,
I
we
think
have the pediatric hospital.
number one in the
Yeah.
country, in the
Yeah,
world. For
we
that.
have the only pediatric hospital we don't have is the one in Akron. All other pediatric
Akron
hospitals in the
children.
state are in their network.
Okay.
Yeah. So Tony, let me help you out because I went through the website, the CareSource website a while back, just so I understood.
Oh, thank you, sir.
So, and you can deny if I'm wrong or tell me I'm wrong. So I've got Metro in Cleveland. I've got Metro Health, the UH system, UH Rainbow Babies and Children's. I see Southwest General. I see Lake Hospital, which what I was just told the other day is now part of the UH system.
University.
Yeah. EMH, Mercy. In Akron, I'm seeing Akron General because that's probably it's a CCF hospital. However, it's probably Access to Care in Akron that you have them, is my guess. Suma Hospital, Edwin Shaw, Mercy Canton, which is also another Cleveland Clinic deal. UH Portage, Robinson Memorial, Worcester Community Hospital. Then over Youngstown, I've got the Mercy System, St. E's, St. Joe's, Stewart in Trumbull County. And I'm not sure if Northside is a hospital or just a clinic.
It does have a hospital aspect to it, but it's not what we would consider an acute care hospital.
Got it. Okay, so I did it mostly for Northeast Ohio because you and I are here. Over in Steubenville, Wheeling area, it's Trinity Hospital, Wheeling Hospital, Harrison County Community Hospital, Barnesville Community Hospital, Southeastern Ohio Regional in Cambridge, and over in the Ashland, Mansfield part of the state, Firelands Regional, Fisher Titus, Bellevue, Fremont, Mercy, Wyandotte Memorial Hospital, and then St. Rita's and Lima Hospital in that area. And that's all that I captured.
That sounds right.
The list that we have, I think, already in Cincinnati and Columbus. Let me find my little sheet here that has all of that, unless Jeff has one handy. I have in Cincinnati, University of Cincinnati, Children's Hospital, Mercy, Christ, and TriHealth. So that looks like 5 of the 6, which is really awesome. I see OSU, I see Nationwide, which is Children's. Dayton is Miami Valley and Kettering. Lima is Lima Memorial. And Toledo is the Superfecta, which you have ProMedica, which is hard to get to for most carriers, as well as Mercy. Am I about right on those?
You're about right. Yeah.
Wow.
I didn't hear any lies in there.
All right, good, because I hate having to cover my tracks if I lie.
I hear you, brother. I hear you.
Good. What else? Oh, you know what, Tony? I I didn't hear you mention it, but I wrote some notes down from your in-person meeting here in Cleveland that if you didn't share it, I wanted to let the brokers online know. Did you tell me something about endocrinologists? I'm going to let you finish.
Yeah,
the
we
statement
have.
because you did.
Yeah, we have in our states, and this is for well, it's for all our plans, but more importantly for the diabetic plan. Our list of endocrinologists is extremely large. We have some of the larger clinics in the state, and we are blowing that out even more, adding more and more of them as we speak.
And I heard that an endocrinologist is a specialist, but CareSource was doing it as a PCP copay. Is that still true?
Well, we're trying to get that done. We're trying to get that done.
Okay. All right.
Yeah.
Well, now there's more pressure on
yet.
you to do that.
No, that's it's we need CMS approval because they're technically not primary.
Okay.
But we're trying them to consider them primary because we're talking about diabetics.
Got it. And then you also talked about the ability to print ID cards. Did you already tell somebody that? Because I was getting a couple texts and phone calls coming in.
Yep. And these came out of our agency council meetings, which we put one together in each state. And we bring in local agents to basically tell us where we need to improve. And two of the areas that they were hitting on the most across all of our states was the inability for a broker to go onto their portal and order a new ID card. That's coming. That's already been done as far as approved, and it should be available. Matter of fact, I think it's available now. I think the communication went out about a week ago, telling them that capability is now on their portal, that they can order cards. They can see a picture of it, so they can snap a picture if they want to, or they can have it mailed to the member themselves. The other thing that was something we've been complaining about, and so it was nice that the brokers complained about it as well. But now we were also going to have the ability at the time of enrollment to set up automatic payments. So you don't have to wait for the member number to show up with CareSource. You can do it right at the time of enrollment.
Great. That's great.
Yep.
I think that was all on my list. You talked about IMED obviously already. So here's a question, because I had a broker question it the other day when I said, well, look, here's all the hospitals, it was here in Northeast Ohio. So that's a pretty robust list. And the comment was they might have the hospitals, but they don't have all the doctors. And I never like saying that because where I worked before, and I was, with confidence able to say that in Ohio, that carrier had over 100,000 providers, doctors, NPNs in the network. Do you have any kind of general number to share that you've heard about Ohio?
No, but
provider?
I'm actually trying to get it. We want to build that into our heat map so that we can show. But it's I can get ours, and they're getting me that number. But the problem is I want to get it for all the competition as well, because it kind of takes away from the heat map if I'm just showing us and not somebody else. So if it comes down to it, I'll do it. But then we really don't want this to be a sales presentation. We really want it to be just a fair look at an area, and whoever ends up the best is the best, right? That's important to us because we think we lose credibility with this if we start turning it into a sales tool, which we don't want to do.
Yeah, that's awesome. That just helps justify and validate what a great carrier you are. And most people maybe think about the Medicaid side of the house and don't really think about the credibility that it does have in our state and some of the others. So
I appreciate that.
Yeah, no
Thank
worries. You. Yeah. Oh, you're getting a compliment from Heather to say thank you for helping get that auto pay thing set up. It's a huge plus. All right. So all compliments should be recognized. And then everybody, I don't know if you saw, but it shows up on my screen as blue, but there's the Eventbrite link for the Ohio heat map if you open up the Q&A little section there. I know Jill has been really good and Christine's been good about the Q&A, but some of you others haven't seen it yet. Go and check it out. Well, listen, we finished ahead of schedule, I think, unless there's any other questions. You're all free to go, and happy selling. I know a lot of you are already highly engaged in Medicare, so go do it, and we'll keep providing you more information. I think we've got maybe one more training this week, and I think we have a few left with other carriers next week. So we wanted to really get them in before 10:15 started. So anyway,
Absolutely.
Thanks everybody for being on the call. We really appreciate it. Thanks to Tony. He's awesome. We were like, when we first met, it was like instant buddies because of our shared past stories. So anyway,
Yep.
Good deal. Jeff, anything else?
No, that's it. Thanks so much, Tony.
Cool.
All right, guys.
Yep,
Thank you. I
you
really
got it.
appreciate
All
the
right.
opportunity to convey our message.
Yeah, and Tony, if there's anything sort of in print that you want to send to Jeff and I, you can go ahead and do that. Like the print source thing, I don't get to see those things, but if you have anything like that, send it to me, and we can always make sure we distribute it, at least to the brokers on the call or the wider audience.
We'll get it out to you.
Thanks, brother. Appreciate it. Have a great day. All right, you
Thanks,
got it.
everybody.
Bye,
Bye, everybody.